Hi sweeties, how are you doing? Welcome to Cimnanya. If this is your first time of coming across this channel, sweetheart, kindly smash that subscribe button, turn on the notification so you get notified each time I upload, and please give this video a thumb up. I appreciate you all and thank you all so much for always coming through. You all are super awesome. Thanks a whole lot. So today we'll be talking about a white lady who actually said that Black women are more likely than any other race to be harmed in pregnancy. And she went further to say that like Black people do not get adequate health care in United States. Like white people do not treat Black people fairly in health sector. And she went further to give examples and say why she said so. And she was like, this might actually get her in trouble, but she doesn't mind. Stay close to the screen. Let me roll the clip. We'll come back to talk about it. And of course, I want to read what you got to say about this. So straight up, let's get into it.
I'm well aware that what I'm about to say could get me in a lot of trouble, but I think it's important enough to say. I'm a labor and delivery nurse, and I treat my Black patients differently. I've seen nurses, especially labor and delivery nurses, online saying things like, I'm colorblind, I don't treat my patients any differently, meaning that they don't treat their Black patients worse than they treat their white patients. And here's why it's not enough to be a colorblind nurse in 2023. Because I know that in my specialty, labor and delivery, Black women are more likely than any other race to be harmed in pregnancy, childbirth, and beyond. The US is the worst place to have a baby if you're Black in the developed world. Why is this not happening anywhere else? Systemic racism. If you don't believe me, just Google James, Mary, and Sims. So not only are Black women not believed about their pain, not believed about their symptoms, but also they may put off getting something checked out because they don't trust medical providers for good reason. So here's how I treat my Black patients differently. Number one, I don't expect them to inherently trust me because I'm wearing scrubs and a badge, and I don't get offended if they don't. Many Black women are coming in to have a baby already having experiences of not being listened to. And until I'm able to prove to them that I'm someone that can be trusted, they shouldn't trust me. More than my white patients, I emphasize the fact that I will always believe them. Yes, my white patients know also that I will believe them, but I really, really drive it home that I promise you that I'm going to believe everything that you say. I include every single person in the room who is supporting this patient in a conversation about preeclampsia, even if they don't have it. Because preeclampsia is one of the leading causes of maternal mortality in the United States. And preeclampsia can happen even after you've had your baby. I tell them about the symptoms, and I also tell the support people that if you hear her saying any of these things, make sure that she gets seen. And if when she gets seen, you don't feel like she's being listened to, go somewhere else. I let them know that I'm here to be their birth bouncer, and I'm not going to let anyone do anything to them, only for them and their baby with their permission. I can neither confirm nor deny whether I have slapped a provider's hand away when the patient said no. I don't know anything about that. I have no hard data to back this up, but I have a hypothesis that Black women are not being repositioned in labor as much as white women. So my patients know, and I will say this, that I'm going to turn you like a rotisserie chicken because movement is gold in labor, especially after you have an epidural. If when we have a baby, I don't like the amount of bleeding that I'm seeing, I am early talking to that provider about, hey, what do you think about maybe giving a little bit of Cytotec? What do you think about putting in a Jada? Because postpartum hemorrhage is the leading cause of maternal death. I will always use whatever privilege I have to make sure that my patients are heard. That's why it's so important to treat your Black patients differently. And if you're a colorblind nurse, you're part of the problem.
You know, I have actually I have actually done some reactions about healthcare, like on my main channel, about how Black people are being like ignored with their how they feel, and sometimes when they feel pain and complain, and they don't even give them anything to subside their pains because they feel like Black people like, I don't know what they think, but they probably think that we don't feel pain or something like that. And I have heard how or also read about how like Black women are not, especially pregnant Black women are not taken care of during childbirth and all of that. So, and I am like, why would a professional nurse or a doctor would see something going wrong just because of your color or the color of your skin? they will not attend to you, or like, you know, give you the necessary attention they are supposed to. I mean, it's unprofessional. Forget about race and all that. I mean, it's already unprofessional on your own part, because like, you are supposed to treat your patients fairly and the rest of it. Anyway, this is all I got to say about this, and I want to read all your comments. Let me know what you all think about this in the comment section. Thank you all so much for all the support, and see you all in my next video. Bye for now.